Yeah, we're really excited to present this study. Again, we had robust enrollment, 40 evaluable patients, which is a lot for a rare disease such as BRAF mutated ATC. The 40 patients were spread across the 6 centers. As part of this trial, we have the 3 phases. We have a neoadjuvant phase where they start with a short run-in of Dabrafenib, Trametinib, which is 21 days, 3 weeks. Then they start the immunotherapy. That's DTP. That's the P of the DTP. That's considered cycle 1 when they start the DTP. They undergo 2 to 7 cycles of the DTP, and then as soon as they become surgically resectable, which is evaluated every 2 cycles, then they undergo surgery. Now, the endpoints of this trial were, number 1, surgical resectability, because we want to know, traditionally, I should back up and say, traditionally, only about 5% of anaplastic thyroid cancers, which are de novo, known anaplastic thyroid cancer diagnosis, are surgically resectable. So that was kind of our historical control, and we wanted to compare what the resectability with this regimen, where we felt like we could rapidly and dramatically shrink the tumor in many of these patients, would compare. So the primary endpoint was surgical resectability. 39 of the 40 patients were evaluable, so that was our denominator. So 29 of the 39 were able to undergo a surgery with an R0 or R1 resection. That means a complete surgical resection with either negative margins or positive margins, but it's a complete surgical resection. So that number we were very excited about, 74% surgical resectability. And then, of course, the second endpoint, as you would imagine, is overall survival that we were looking at. So the overall survival, we used a historic control of 9.6 months, which is a median for Dabrafenib plus Trametinib. Now, I should back up and say the ROAR trial, again, which led to the FDA approval of Dabrafenib Trametinib, had, when it was ultimately published, had a 14.5 month overall survival. We didn't have the results of that study when we designed this study, so we used this 9.6 number as our historical control, and that's how we designed the study. But the overall survival, as of a cutoff date of May 1st, 2025, which we're presenting the data today, with a median follow-up of about 20 months, is 18 months. So that overall survival is far superior to what our historic control of 9.6 months is for DT, and what we saw in the ROAR trial with DT. So we're very excited about these results, and we think that the DTP regimen, the triplet therapy upfront regimen for BRAF mutated anaplastic thyroid cancer, should be a standard of care for BRAF mutated anaplastic thyroid cancer, and that it should be incorporated into treatment guidelines.